Hello everyone, welcome to sqadia.com, and in this section of our lecture topic examination of gynecological patient we will discuss some diagnostic procedures. Different diagnostic procedures done on gynecological patients include urine collection, then methods for examination and collection of urethral discharge, and methods for vaginal and cervical discharge collection. So diagnostic procedures include some blood tests in which usually a CBC or complete blood count is very important in gynecological patient. If their hemoglobin level is normal, if their hemoglobin is less, usually they need sometimes blood transfusion or iron pills to get the hemoglobin back to normal. Similarly, some leukocyte count is important, ESR count is important. So some blood work is very important to be performed in gynecological patient. Then examination of the urine is very, very important step, and it can be routine examination of the urine or microscopic examination of the urine. Or there it can, then another test done on the urine will be the culture of the urine, and the drug sensitivity test is also performed on the urine. So method of the urine collection. Different methods are used for the collection of the urine. Very important is the midstream urine collection, then collection of the urine by the catheter and suprapubic bladder puncture, and collection of the urine through the puncture of the bladder. In the catheter collection, usually the catheter is inserted inside the urinary bladder, and then the whatever urine is collected in the urinary bag is transferred into the urine cup and then sent to the lab for different tests on the urine. The urine collected by the catheter is usually used for very, very sterilized procedures like urine culture. Urine culture should be done on the urine collected by the urine catheterization. But midstream urine collection is done for most of the routine urine tests done like pregnancy tests done for protein level, glucose level, tests done for white blood cells, any ketone bodies. Usually the midstream specimen is collected for that. And always ask the patient for midstream collection of the urine, label the cup and give it to the patient and tell them to clean the external genitalia really good with the swab, and then discard the first portion of the urine in the toilet and collect the middle portion of the urine in the cup, and then discard the last portion of the urine in the toilet also. That's midstream urine collection, and that's very important to demonstrate or dictate the patient how to collect the midstream urine sample. And it's done for most routine urine tests done, midstream urine specimen. Catheter collection is done mainly for the urine collected for the culture, urine culture test. Again, catheter collection is cleaning the external genitalia. This is the catheter, and then the tube is inserted inside the urethra, and then urine is collected in the back. This is the suprapubic bladder puncture. If you see, the needle is inserted into the urinary bladder and urine is collected. This is the diagram showing the urethral discharge collection. Urinary bladder. Urethra is the lower portion of the urinary bladder through which the urine comes out of the urinary bladder. So if there are any abnormal discharges from the urethra, then it's important to get the urine discharge collection, and that is done by the swab. It's inserted into the urethra and the specimen is collected, and then it is sent to the lab for the culture or the test to find out what's the causative organism for the urethral discharge. Okay, so in this slide, this is the picture showing the how to collect the specimen from the cervix and the vagina. And this is the vaginal speculum. Vaginal speculum is inserted into the vagina, and then this is the spatula. This is the spatula that is used for collection of the specimen from the cervical and vaginal wall and cervical scrapings. And when this cervical scraping and the specimen is removed, then it is on the glass slide, we put that specimen from the spatula on the microscopic glass slide, and then we put the fixative spray on the slide. Once the fixative spray is sprayed on the slide, then it gets fixed to the slide, and then we can send this slide to the lab for the examination. So spatula, wooden spatula is used for the removal or the scraping of the cervical scraping, removed to examine any discharge or any abnormal changes in the cells of the cervix and vagina. Another thing which we can use is the cervical, it's called the cervical brush, which is used, it's a soft brush that is used for the endocervical region, because endocervix is the very vascular area, so it's better not to use the wooden spatula on the endocervix so get the specimen from the endocervical area or inside the cervix. It's very vascular, so brush is used to remove the tissue from that, so to avoid excess bleeding. So this is wooden spatula and the endocervical brush are the two things used to remove the tissues or scrapings from the cervix and the vaginal wall. And then a slide is prepared, and then it is sprayed by the fixative and then send it to the lab for the different study of the cells and the tissues, or if there is any abnormality. So that was all about the urine collection, methods of urine collection, collection of urethral discharge, and collection of the vaginal and the cervical discharge. Thank you for watching sqadia.com.